infection. So this is the difference between infection and colonization. So colonization is asymptomatic. Also, infection may be asymptomatic in its first stage. So this one may question the term infectious disease for asymptomatic infection, because it was, in strict sense, it should have the patient-host response, which may result in the host response may go asymptomatic. And sometimes the virus will, or the bacteria or the fungus will go through all these stages of establishment, replication, and causing harm, in addition to inducing host response. But the clinical manifestation is absent. It is also caused asymptomatic infections, what we call it asymptomatic infections. So the host may induce host response, but it is asymptomatic. So we have colonization, only replications, and doesn't cause harm or induce host response, versus infections that result in all these stages of genesis of infection. واضح طلاب هسه بالنسبة للinfection or infectious disease, these synonyms used in this lecture, in comparison to colonization, that will not result in harm or host immune response. Here is the of communicable disease. What we mean by communicable diseases. Communicable diseases are infectious diseases that are transmitted between hosts. So there is transmission between one host to the other. Common examples are measles, Ebola, influenza, and hepatitis B, through different modes of transmission. So these diseases are called communicable diseases. On the other hand, where those cause organisms that are already colonizing the host, so our bodies are colonized by billions of bacteria. What we call this disease is called endogenous infections, because these organisms are colonized in our bodies. So we call it endogenous infections. For example, common examples of endogenous infections are oral candidiasis, or we call it oral thrush. So this is an endogenous infection. Whenever the host immune response, the host become immune compromised or immune depleted, these will multiply and cause symptoms. So we call it oral thrush. It results from colonization to disease. In the colonization state, these organisms are usually asymptomatic and will not cause disease. But once it is overgrowth and result in host immune response and symptoms, we call it disease. So endogenous infections or diseases. The common example is oral candidiasis. The other example, for example, dental caries, etc. So we have definitions of infectious disease or infection, followed by colonizations, communicable diseases, endogenous infections. So these are an introduction to my lecture. Some definitions, I think we already covered these, but just to, in the microbiology course, but just to remind you of these infections. What about the definition of infectious agent? Definition of infectious agent. The first concept is reported by Robert Koch in the 19th century. What are the principles he put at that time to define an agent to be infectious? Number one, the same organism must be present in every case of the disease. So when we diagnose the patient has, for example, enteric fever, this disease, whenever we culture this patient, we have to identify this organism rather than different organisms responsible for the manifestation of this disease. So we'll culture Salmonella typhi, for example. Number two, the organism must be isolated from the disease host and growth in pure culture. So the same organism responsible for every case, for every manifestation of the disease, and the organism must be isolated from the disease host. For example, blood culture from every patient who present with enteric fever, and grown in a pure culture. Then the isolate must cause the disease when inoculated into a healthy, susceptible animal. So this organism, whenever cultivated by the culture, once it inoculated inside, for example, a susceptible animal, it will cause a result in the disease manifestation. And subsequently, the organism must be re-isolated from the inoculated disease animal. So this is the original concept postulated by Robert Koch for an infectious agent, which is the foundation truly in the infectious diseases nowadays. An important concept in the infectious diseases is the chain of infection. Whenever we try to control a disease, we have to know its chain of infection. So we have an infectious agent. Number one, this infectious agent may live in certain reservoirs, for example, animals, insects, human beings, etc. And it has a certain route of exit, for example, either by vectors, respiratory route, GI route, skin route, and this a way of transmission to the other hosts, for example, by respiratory route, oral route, etc. This is the mode of transmission, then followed by the entry into the, for example, skin, injections, mouth, respiratory system, GI system, susceptible hosts. I will give you an example. For example, in malaria, there is a reservoir for malaria, which may be the certain people, certain animals. Then the vector will transmit the disease to the other hosts, susceptible hosts. So in the reservoir for malaria is the human beings, and the anopheles is the vector responsible for the transmission of the disease. Another example nowadays is the SARS-CoV-2. SARS-CoV-2, when initially identified, it has a certain reservoirs, for example, in certain animals like bats or wild types of bats. Some postulate that it's from the certain snakes, etc. Whatever the reservoir, this will be has an exit route through the saliva of these bats or snakes, and then transmitted to human beings during slaughterhouses, transmitted by the skin route to the respiratory system, and this will get an infection, and then this transmitted to the susceptible hosts, and the cycle will repeat itself. So the chain of infection, in order to control any disease, you have to know its chain of infection and break this chain of infection. So we have to break, for example, the reservoir. We have to break the transmission, and if possible, transmission here is very important. Sometimes you cannot control the exit infection in some diseases, but the transmission most of the time can be broken out by proper hand sanitations, possibly by wearing mask, etc. And controlling the susceptible host by giving, for example, vaccinations. واضح طلاب؟ هسه بالنسبة chain of infection, and this is very important concept in every infectious disease. So in every lecture we have infectious disease, you have to know the infectious agent microbiology, you have to know its reservoir, its exit route, its mode of transmission, for example, respiratory route, fecal-oral, droplet, airborne, skin, etc. Then we have to know the susceptible host and how we can deal in the prevention of this susceptible host by variety of methods. So this is the chain of infection. اكو سؤال طلاب لحد الآن واضحة إن شاء الله؟ Okay, so we'll, this is an example of how bacteria are identified. As you know, in the microbiology, this is just to have a look on this slide. This is a busy slide. I think you're already familiar with these methods of identification of the microorganism. For example, in the gram stain, in the microscopy, cell associations, colonial characteristics, atmospheric requirements, and sometimes it's classified according to this, or biochemical reactions, for example, oxidase, catalase, antibiotic susceptibility, and more advanced techniques for identification, like in PCR, whole genome sequencing, and etc. So the organism must be identified to know whether this patient has infectious disease or not. in some situations طبعا. هذا شنو نسميه؟ أكيد أخذتوه. We come across this. You come already across this method for identifying bacteria, right? So this is a classical blood agar, right? So next in my topic, كملنا من identification of the bacteria. There is a concept which we call it. هذا طبعا هو الشابتر انضاف يعني الشابتر مال infectious disease يعني تقريبا من 2000 و I think 2014 the concept of normal microbial flora, a new term introduced in the chapter of Davidson since 2000, I think 10 or 12. The human body is colonized, so it's colonized. It is not causing harm or disease. The human body is colonized by large numbers of microorganisms. These organisms in different parts of the body, we call it a human microbiota. This is the term human microbiota, the new term for normal microbial flora, the human microbiota. So when you hear the name, human microbiota, we synonymally use as a normal microbial flora. Okay, so this is a colonized microorganisms. And this is an example of the normal microbiota that are colonized different parts of the body. These normally, in a normal immune competent host would not cause any disease, unless there is a breach in the integrity of the normal barriers. For example, in the innate immune response or the cellular immune response. So we should have a way to look for these organisms because very important. يعني عندنا skin, mouth, which is heavily cultivated by multiple flora, in the GI tract. This is another example of the human microbiota, and etc. So there is, for example, a breach in the skin. So this microorganism, the normal colonization will result sometimes in disease. For example, in coagulase negative Staphylococcus aureus. عملية خالية مثلا cannula. Without this cannula, the Staphylococcus negative, coagulase negative Staphylococcus will not cause any disease. When there is breach in the integrity of the skin, which is a part of the innate immune response, there will be replication followed by harm to this skin and followed by signs and symptoms of, for example, cellulitis. So the likely organism would be either coagulase negative Staphylococci or Staph aureus. And etc. نفس الشيء. مثلا المريض لو ماخذ frequent courses of antibiotics, this will result disruption of the normal flora, and the patient would subsequently result in diarrhea. Caused, for example, by Clostridium difficile species, because there will be imbalance between the growth of different macro. Some of them will be killed, some of them will remain and will flourish, will result in symptomatic infection. Okay, طلاب. So the normal microbial flora or the microbiota, as I said previously, the GI and the mouth are the most two heavily colonized sites in the body, and their microbiota are distinct in both composition and function. Okay, so whenever we have bacteria, we can identify it whether it's come from the mouth and the GI tract. So knowledge of the non-sterile body sites and their normal flora is required. Why? Why we should know these microorganisms and different body sites. يعني كل body site لازم نعرف usual microorganisms that are normally colonized. So do you have any idea? Or you can write in the chat box. You would share your answer. So the question is why you should know each normal microbiota that are cultivated in certain parts of the body. For example, in the skin, in the GI tract, in the female genital tracts, in the mouth, etc. Why you should know these microorganisms?
دكتور يعني نقدر نقول انه اذا تغير مكانها، لانه اذا تغير مكانها تكون ريليشن شيب مختلفة بين الانفايرمنت مالتها، فممكن cause infection يعني.
Okay, good way to think. Maybe this is a possibility.
يجي في بالي مثال ايكولاي.
Okay, good to think. يعني could you give me an example of what you said? Okay, good way to think. Yeah, Jafar. So Zina wrote, so in case of infection, you can identify the responsible pathogen from the known flora. Excellent, Zina. So if the patient have, for example, diarrhea, and we would know the causative organisms, okay? If the stool of the human being are filled by millions of colonized bacteria. So if we would not know these organisms, the normal colonized organism will not notify the microbiologist, which is the pathogenic and non-pathogenic. Okay, and for example, a patient presented with sore throat, and we have to take a swab from the throat. The mouth is already colonized by many bacteria, which are endogenous and not causing disease. Okay, good, Zina. So, knowledge of the non-sterile body site. Non-sterile, what we call it, for example, the GI tract is non-sterile. The female genital tract, the mouth, these are non-sterile sites. Whereas, for example, the urinary bladder is a sterile site. Okay. Sputum, for example, if you send sputum for culture, this may result in growth of normal flora, which is not considered to be pathogenic. Whereas the growth of, for example, of Mycobacterium tuberculosis, if we identify Mycobacterium in the sputum, this is not considered colonization. This is considered always a disease. Okay, the normal microbiota. So, are there any benefits of these microorganisms? Number one, especially in the GI tract, it's able to synthesize and increase vitamins K, especially vitamin K. So any disruption of this normal human microbiota will result in deficiency of vitamin K, example by the excessive use of antibiotics. Number two, these organisms will offer colonization resistance to the invading pathogen by modulation of the local environment, for example, lowering pH. This is a very important concept. Or sometimes by producing certain bacteria antigens, for example, antimicrobial peptides, fatty acids, and metabolic waste products that will interfere with the invasion of other pathogenic microorganisms. And in addition, an important new concept is inducing host antibodies. The host will induce antibodies to these normal human microbiota that subsequently cross-react with the pathogenic organisms. For example, the pathogenic E. coli versus the normal colonizing E. coli. Sometimes these antibodies will cross-react with the microbiota and with the pathogenic organism and result in beneficial immune response. So there are definitely benefits of these human microbiota. What about the normal flora that contribute to the endogenous disease? How? For example, translocation to a sterile site, when the normal microbiota will cause disease, when there is any disruption of the immune response or immune state of the host. For example, translocation into a sterile site, for example, in spontaneous bacterial peritonitis, noticed in a patient with liver cirrhosis. So there will be accumulation of fluid inside the peritoneal cavity and disruption of its barrier. There will be subsequent translocation of bacteria from the bowel that are normally present to the peritoneum. Peritoneum is usually sterile. It has never has no organism. So if we have a culture of E. coli inside this peritoneal cavity, despite this, the presence of E. coli in the bowel is considered normal, it is not considered normal inside the peritoneal cavity. So it is called a disease. So we call it spontaneous bacterial peritonitis. This is the first concept, how normal human microbiota cause a disease. The second concept is excessive growth. When there is excessive growth of certain microorganisms at a normal site that used to be present. For example, the mouth of a human being usually have Candida species. But when there is disruption of the immune response, for example, يعني مريض كان ياخذ frequent courses of antibiotics, or for example, other immune suppressants, this will result in disruption of the normal amounts of bacteria, the endogenous bacteria, the normal human microbiota, and will result in excessive growth of this fungus, Candida albicans. This is an example of Candida albicans in patients received prolonged courses of antibiotics. Also, vaginal thrush and blind loop syndrome when there is excessive growth of normal human bacteria inside the bowel. Why? Because of disruption of normal movement or normal bowel movement in a patient with, for example, a patient who have motility disorders. For example, in a patient who has scleroderma, which means that thickening of the skin and involvement of the viscera. So there will be stagnation of the content of the bowel, and there is excessive growth of bacteria inside the human stool, and this will result in pathological diarrhea. So when there is an excessive growth, or when there is translocation into a sterile site that the bacteria should not present in this site. So this is how the human microbiota will cause a disease. So it is in one side, it is a normal human microbiota to provide a lot of function and prevention from other diseases, while the other hand, excessive growth or translocation will result in endogenous diseases. Okay. So the normal flora also contributes to disease by cross-infection. How? Normal flora also contribute to disease by cross-infection. In which? How? In which organisms that are colonizing one individual, for example, one individual have a certain colonization by certain species of bacteria, cause disease when they transfer to another, more susceptible individual. So could you give me an example of this sentence? So read it carefully, and could you give me an example? Normal flora. So we are talking about normal flora in one person cause a disease in another person.
دكتور ممكن نقول يعني المننجايتس and يعني birth children أو خلينا نقول بالنيونات عن طريق الأجلاكتية اللي هو Streptococcus agalactiae.
Okay, good. So Streptococcus agalactiae can cause a disease. Yes, good example. Another example. Good, thank you. Okay. If you couldn't, you can write in the chat box if you have any answer. So maybe Streptococcus agalactiae. And also the pharyngeal carriage. Sometimes the Neisseria is present in the normal pharyngeal carriage in the teenagers and may cause disease in adult person. Another example is Clostridium difficile, that sometimes present in one person when it is transferred to another immune-compromised patient will result in severe Clostridium difficile colitis. So this is another example. Okay, Clostridium difficile infection, Clostridium difficile, when it transferred to another, how another susceptible individual. For example, patient taking, I am colonized with certain strain of Clostridium difficile. If I am in contact, because it is usually transmitted by fecal oral route, so if I would not wash my hand perfectly, I'm come in contact with another person who has immune compromising state, who has received courses of antibiotics. When I acquire this, that I have already colonized, I'm not causing a disease because I am immune competent person. So when this, the another person who acquired this certain strain of new strain of this endogenous bacteria will cause disease state. Why? Because his already normal microbiota is disrupted and didn't contain this strain of Clostridium difficile. Rather commonly, we notice this commonly in hospitalized patients who develop new onset diarrhea. Why? Because hospitalized patient received, for example, immune modulating antibiotics will result in disruption of the normal microbiota, and acquisition of new strains that are unfortunately present in the hospital, despite sanitation measures. Okay. So this is a homework for you. What are the probiotics? Probiotics. So in the market, there are a lot of probiotics now, and there are a lot of talks in the management and the prevention of some diseases. Okay, and I think some of you will be familiar with these probiotics. So what are the probiotics and its uses? This is a homework for you. Okay, Tulab? The next step or the next slide is the host-pathogen interactions. Host-pathogen interactions. There are some definitions of this interaction. The primary pathogens. Primary pathogens cause disease in a proportion of individuals to whom they are exposed, regardless of the host immunological status. So this is called primary pathogen. So to cause a disease state, whether the host is immune compromised or not, we call it primary pathogen. On the other hand, opportunistic pathogens cause disease only in individuals whose host defenses are compromised. For example, by patient مثلا خليله cannula, intravascular catheter, or when, for example, taking an immune modulating drugs. So this is if a disease process called by, for example, candidemia, this is called an opportunistic pathogen. If we find a culture of blood and the result, جوابكم الرزق قال لكم Candida albicans, this is what we call it opportunistic pathogen, because it is cause a disease state when the host immune response is compromised. On the other hand, the primary pathogen may cause disease whatever the cause. تقدروا تعطوني example بالprimary pathogen and opportunistic pathogens. So what are the examples of primary pathogen and another examples of primary pathogen and opportunistic pathogen?
دكتور الكلوستريديوم بوتولينيوم هاي برايمري باثوجين.
Very good, Ahmed. So Clostridium botulism, the disease caused by Clostridium is usually affect whether the immune state of the person is compromised or So Clostridium botulinum is a disease of a host, whether it is immune compromised or immune competent. Another example, the Clostridium difficile is also a good example of opportunistic pathogen.
Diphtheria, Dr. Hamad?
Diphtheria is also an example of primary pathogen. There are a lot of pathogens, for example, hepatitis B, okay, influenza, malaria. These are examples of primary pathogens. Thank you, Ahmed. So the disease process depends on whether the immune state and the virulence of the organism. And sometimes the virulence of the organisms will decide whether the patient will develop a disease or not. So very virulent organisms, this is likely to be a primary pathogen, while the organism that has low virulence may fit into the opportunistic pathogens. So what are the characteristics of successful pathogen? How the pathogen should have certain criteria in order to invade the immune system and develop disease. So they compete with the host cells and colonizing flora by various methods. So you should have compete the host cells and the colonizing in order to produce a disease by, for example, having a motility apparatus, using certain adhesins, or from biofilms, that these biofilms will prevent the invasion or the penetration of antibacterial agents into this biofilm. So render the organism insusceptible to the effect of antibacteria, or by producing certain toxins to induce the disease process, for example, in botulism, in Clostridium, and tetanus, etc. or survive the intracellular environment, for example, in Mycobacterium and tuberculosis. So these are examples. Motility, adhesins, biofilms, toxins, intracellular environments survive in the macrophage especially, or especially after phagocytosis. This is an example by Mycobacterium tuberculosis. So these are some of the criteria that a pathogen considered to be successful. This is an example of exotoxins mediated bacterial diseases. And you should have a knowledge of this diagram, very important. For example, antibiotic-associated diarrhea or pseudomembranous colitis. The responsible organism is Clostridium difficile, the botulism, Clostridium botulinum, cholera, Vibrio cholerae. So this disease is mediated by exotoxins, etc. What about the host response to this invasion? We've been said that this host immune response depends on the virulence of the organisms. Either it can be or it could be controlled by the innate immune response and result in elimination of this organism, or sometimes it needs a collaboration with the adaptive immune and inflammatory responses, which is mediated by certain types of lymphocytes, for example, the B cell and the T cell. So the pathogenesis, in summary, the pathogenesis of infectious disease depends on the virulence of the organism, number one, and number two, the host response to infection. So the host response to infection is very important. So despite the obvious benefits of intact, sometimes the host response is perfect. It could control and eliminate the infection, but sometimes it would be undesirable. This excessive host immune response will result in damage to the other organs away from the site that is already the organism present. For example, nowadays we see it in the cytokine storm in COVID-19. This storm is usually caused by excessive immune response to the originating organisms. So this excessive immune response will result in the damage of the infected cells and the normal cells. So they result in multiple organ failures. For example, pulmonary infiltrate, lung injury, acute respiratory distress syndrome, cardiovascular shock, disseminated intravascular coagulation, and renal failure. So there is an excessive immune response in comparison to the normal host response. The aim of the normal host immune response is to control infections rather than inducing damage to the same organ that is infected or the other distant organs. واضح طلاب الكونسبت؟
واضح دكتور.
So the pathogenesis depends on these two important, and the balance between the host response to infection versus the virulence of the organism. If the virulence of the organism is much higher than the host response, this will result in the disease process, uncontrolled replication of the virus or the bacteria, and will result disseminated infection. يعني عادة familiar tuberculosis يعني عادة نشوفها المريض اللي هو immune compromised. Why? Because there is poor immune response to contain the infection, result in dissemination of infection. While if the host response is much higher than the virulence of the organisms, and it will result in, so it is a sword with two edges, it may cause harm to the host.
دكتور
نعم.
يعني ليش بالاكسسيف هوست ريسبونس يصير عندي مالتيبل اورجان فيلر مثلا؟
Why? Because it is induced by the mediators of the immune response. For example, in COVID-19, why there is different organs affected by this patient despite minimal or moderate infection. Why? Because it is induced by the host immune response cells that excrete different cytokines. For example, these are the examples of cytokines. These cytokines will result in multiple organ failures. Okay.
دكتور انا قصدي يعني ليش ما يكون فقط بالمكان يعني هو مال site of infection يعني هل هذا يعتمد على انه
This depends on the immune response of the patient. Sometimes there will be immune dysregulation. This is the concept of the host response. Sometimes the immune regulation, there is regulatory, for example, cells that will guide the immune response. يعني تقول له بس تعال على هاي infected cells and kill them. But when there is host dysregulations, the immune cells will attack the normal host cells and will result in death of the host cells. Okay? How this will be guided, it depends on the immune status of the patient. It depends on the other mechanisms that are sometimes unknown. يعني we don't know which patient is susceptible to the, for example, in cytokine storm. Yes, we have some known factors, but the other is unknown. And another example of this dysregulated immune response, and could you give me an example of an exaggerated immune response to infection other than, for example, COVID-19? We see it, this pattern of excessive immune response before that, before COVID-19. For example,
بالروماتيك فيفر مثلا يعني او SLE.
We are in the infectious disease. Outside the infectious disease, yes, there are a lot of examples of dysregulated immune response. Immune disease, immunological diseases caused definitely by the dysregulated immune response. The immune system will recognize the host cells as without infection, recognize it as, an abnormal or new cells or abnormal cells, or will attack these cells and will result in new manifestations, for example, of rheumatoid arthritis. The immune system will attack the cartilage cells, will attack the mucosal membrane, will attack the heart valves. For example, another example of infectious disease that result in immune dysregulation and immune reconstitution syndrome found in syphilis and found in HIV patient. Okay. احنا نسميه احيانا حتى ان بروسيلا, even in بروسيلا patient, what we call it hemophagocytic histiolymphocytosis, which may be triggered by certain infections. واسم طويل مالته hemophagocytic histiolymphocytosis. This is an exaggerated immune response to an infection. For example, in viral infection, certain, for example, in CMV, cytomegalovirus, and sometimes even in influenza. Sometimes in influenza, the patient may enter into this cytokine storm-like picture, and definitely in some cases of brucella. So here is the rule of to calm the storm, to calm the excessive immune response by giving certain immune suppression. Why? Because it is called dysregulated. It is not, so the immune response is sometimes beneficial to control the infection, but sometimes harmful when to exaggerate this response to infection. So how the host response, the human response to infection, the classical response is the febrile response, So it is mediated by certain pyrogenic cytokines, which, for example, interleukin-1, interleukin-6, and tumor necrosis factor alpha. Okay, these are pyrogenic cytokines released by the immune cells, for example, B cells and macrophage or monocyte. These cytokines ultimately is able to induce the synthesis of prostaglandin E2, which binds to specific receptors to the preoptic nucleus of hypothalamus, causing the core temperature to rise. So these are the mediators will result in binding to the preoptic nucleus of hypothalamus. مثلا احنا عادة normal human being, for example, 36.5. When there is release of these cytokines followed by prostaglandin E2 synthesis will upregulate the normal temperature in the hypothalamus, for example, from 36 to 39. So the order here, so there is discrepancy between the temperature of blood on tissues and the preset thermostat in the hypothalamus. So the body try to reset to the new temperature, which is 39, by what we call it rigors, in order to produce more heat. So rigors is a clinical symptom or sign if they are witnessed, characterized by feeling very cold. عادة feeling, it is a feeling, واحد يقول كان نزمتني الباردة يعني شعرت بالبرودة, plus uncontrollable shivering. So it will result, it will result in vigorous muscle contractions, and this muscle contractions will result in production of heat, followed by an increase in the temperature of tissues, increase in temperature of blood, until the shivering will stop, until the body temperature reset into the new preset temperature by the preoptic nucleus of the hypothalamus, for example, 39. followed by, as a defense mechanism, sweating in order to return to the same temperature that originally present. So the classical response to the temperature, fever, plus minus rigors and sweating. It depends on the preset optic nucleus of the hypothalamus. So low-grade fever, it may not result in feeling of rigors, but high-grade fever initially, for example, the preset temperature of 36, and because of excessive immune response, will result in large amount of cytokines produced. This will result in resetting the hypothalamus into higher grade. So this will result in much more rigors subsequently, definitely. So we come to the how to investigate for infection. Why we investigate for infection? In order to confirm the presence of infection and identify, because there are the manifestation of infection sometimes are non-specific with other disease process. So the aim of this, if there are multiple possibilities of a patient who present with signs and symptoms, and we need to identify whether the patient has infectious disease or not. Number one, we have to confirm the presence of infection by identifying a specific pathogen. And additionally, we may identify its susceptibility to specific antimicrobial agents, which is very important nowadays because of widespread of bacterial or fungal or viral resistance. So the aim of isolation, not only for diagnosis, but also to know it has an implication for from therapeutic point of view in order to know its microbial susceptibility, and in addition to guide a therapy. So what are the tests? There are indirect markers for infections. اللي هي مثلا for white cell count, for example, neutrophil leukocytosis in bacterial, or relative lymphopenia and lymphocytosis in viral infections. C-reactive protein, a classical marker of infection, but it is non-specific. It may be elevated in certain immune diseases. Procalcitonin is very important marker in identifying a patient who has bacterial infections. Serum lactate is also a good marker for infections, especially in sepsis. Not every infection, in sepsis. Cell count in urine, for example, in a patient presented with urinary tract infection, because cell count is usually 0 to 2 in the white cell count in the urine. If it is elevated, it is an indirect sign for presence of infection. Though in a patient with urinary stone, for example, it may have white cell count elevated in his urine. CSF protein and the glucose is also an indirect marker for infection. So direct detection of organisms, as we know, either by microscopy or by detection of the organism component. يعني مثلا الانتيجين. For example, hepatitis B surface antigen. We could identify this marker for the presence of hepatitis B virus infection. Or toxin. For example, in staphylococcal toxic shock syndrome, if we identify the toxin, or botulinum toxin, وهكذا. PCR, which is the nucleic acid material of the virus. In addition to culture of the organisms, as I said, or sometimes we can identify the infection indirectly by the host immune response. And for example, antibody detection, as you know. For example, a patient presented with jaundice in the past, and we are wondering whether he has hepatitis A infection in the past or not. We could send him for hepatitis A antibody response IgM or IgG. Or for example, an interferon gamma release assay, what we call the IGRA. شو يفيدنا هذا الماركر؟ the IGRA assay. طلاب, you have come across this term, the IGRA, interferon gamma assay release assays. It is a marker of, this is a cytokine produced by the lymphocyte in response to mycobacterial infection. Like مريض أعرف عند the previous past infection of TB or not. For example, patient is eligible for taking immune suppression, and we would know whether he was exposed previously to mycobacterial tuberculosis or not. So this is a very useful marker for previous tuberculosis infection. As I think this is the slide is very disk diffusion image for used for identify the antimicrobial susceptibility testing. So if we know that the organism is inhibited by addition of certain antimicrobial agent, this is what you call it susceptible. يعني هسه مثلا هنا control, there are no disk diffusion apparent in the control, while in the ampicillin, methicillin, and vancomycin, this would we call it inhibition of the organism. بذلك الآن this patient, which we call it, this organism is susceptible to ampicillin, methicillin, and vancomycin at various stages. So we have another mnemonic: wherever the art of medicine is loved, so there is a love of humanity. This is, we call it Hippocrates in different centuries ago. We come to the topic of epidemiology of infection. So in regard to the epidemiology, the communicability of infectious disease means that once a clinician has diagnosed an infectious disease, يعني احنا شخصنا مثلا patient عنده hepatitis B, we have to know the potential exposure of other patients must be considered. And when we have to trace the contact of this patient in order why? In order to control the disease process. There are some definitions, what we call the endemic disease or emerging on re-emerging diseases. يعني شنو example مثلا endemic disease in Iraq؟ يعني to keep constant presence in certain geographical population. بالعراق مثلا شنو disease endemic عندنا؟
دكتور كوليرا
مثلا التي بي.
Yes, الكوليرا مو دائما constant presence، نسميها epidemic diseases. بس endemic يعني kept present at certain constant presence. For example, yes, tuberculosis. For example, enteric fever. وهكذا. While emerging and re-emerging diseases, an emerging infectious is only that has newly appeared in the population. شنو a common example هسه؟ Re-emerging هو present لكن it's increasing in incident or geographical range. يعني مثلا احنا الكوليرا هسه حاليا تقريبا ما عندنا هسه كيسات not reported, but if it is reappeared again, which we call it re-emerging disease, okay? But emerging disease, for example, كان مثلا COVID-19 hemorrhagic fever in Iraq, which we call it emerging disease. يعني كانت بال 2014 أو 15. There are a lot of cases reported here in Iraq about hemorrhagic fevers. Person presented with fever, jaundice, and DIC-like picture. Or, for example, Ebola in Zaire and Congo. These are called emerging diseases, okay? But sometimes the disease, when it become emerging, it may re-emerge again when it disappears. يعني مثلا SARS-CoV كان هو وقتها emerging disease in 2012. Then re-emerge again in another variant, MERS, for example, Middle East respiratory distress syndrome, and then in COVID-19. The reservoir of infection, there are a lot of reservoir for infections. How we can define the reservoir? It is any person or living organisms, or sometimes environment, and not only a creature, and living creatures, but sometimes person, living organism, or environment, or combination of these, in which the infectious agent lives and replicates, and on which the infectious is dependent for its survival. This is very important. So the survival of this infectious agent depends on its reservoir. So these are examples of reservoir. We have human reservoir, we have animal reservoir, and we have environmental reservoir. For example, the soil, the reservoir for millions of organisms. So this is a cartoon of the tag here appeared, the quarantine for measles, right? Quarantine for measles affect the cat, the Tom and Jerry, which are animals. But on the other hand, the funny thing is that measles will not affect the animals nor the mice, okay? So this is an example for example. So human beings are the only reservoir for measles, okay? And the transmission of infection, we have already come across these routes of transmission, either respiratory, fecal, sexual, bloodborne, direct contact, or via vector, for example, in malaria, or fomite, for example, the surfaces. So the vector or fomite bridges the gap between the infected host or reservoir. يعني مثلا المقبض مثلا مال الباب مثلا انياجيريزما مثلا contamination, the organism still survive for many hours. The other individual come across this and come contact with this يعني مثل مقبض الباب, وبالتالي حيصير عنده infections. If it is not clearly sterilized, these fomites will keep transmit the infections between different persons. So what about the last content of my lecture, infection prevention and control? And here Hippocrates writes quote, which you call the greatest medicine of all is to teach people how not to need it. So the greatest medicine of all is teaching people how not to need it. Okay, فاحنا لازم we have to educate the patient how to prevent and how to avoid these infections and diseases. So how to avoid infection diseases? By breaking the chain of infection. So if we could break this chain of infection, any part, or multiple parts, we can control the disease by eliminating the pathogen, its reservoir or portal exit, means of transmission, portal of entry, or the new host. يعني هنا different interventions to control. We have different interventions to control we aim to break this chain of infection. So measures used to infection prevention and control. What are these measures? What is present in Davidson? This is a homework for you. This is very important. How you can control the measures used in infection prevention and control. But keep in your mind that the most important one is good hand hygiene. Please always use hand sanitizers when you are in the hospitals. So this is very important prevention, because we may induce infection to the patient. So wash hands only when visibly soiled. Otherwise, you can use alcohol-based hand rub. The optimum amount from the medical point of view is 40 to 60 seconds. This is before operation, for example. But this is the examples. This is the scheme show how can properly sanitize your hand. But a minimum of 20 seconds is suffice for usual practice. But in surgical patients, you have to do the optimum amount for washing. And the type of isolation now very important. يعني مريض مثلا خالي برده عنده مثلا tuberculosis. هو خالي برده. شنو which type of transmission? Because it is very, especially if it is open TB. يعني عنده cavitary مثلا وعنده laryngeal tuberculosis. So the staff should wear an FFP3, or N95 mask. So remember, this is an N95 mask. This is for airborne transmission. يعني مثلا example patient عنده measles and we want to care for this person. يعني we have a tour on this patient. So we should wear FFP3 or N95 mask. Surgical mask is not effective. Contact transmission. So private room preferred. يعني شنو contact transmission؟ يعني يفضل انهم مريض مخلي صف مريض لازم على الاقل otherwise يعني مثلا مريض عنده Clostridium difficile infection صار عنده diarrhea. We should put him in an isolated room. Otherwise, we should interspace between patient and patient at least 1 meter. And for the staff caring or the relative of the patient coming in contact with this patient, it should wear gloves and gown, because the spores of this organism may be transmitted from the person to the clothes to the surrounding of the patient. Droplet transmission. So private room preferred. An example, influenza. So private room preferred. Otherwise, inter-patient spacing more than 1 meter. In addition to surgical mask for staff in common contact with the patient. This is for droplet. But for aerosol, يعني مثلا مريض يخلوا له مثلا بخاخ أو يخلوا له oxygen أو CPAP. Surgical mask will not be a proper method for prevention. We need a more proper prevention. We need this types of mask. But how we can control the susceptible host? By giving immunization, which is either, as we know, either passive immunization or active immunization by giving vaccines, or passive immunization by giving human immunoglobulin. So this is the proper method for controlling of infection by giving vaccines or giving after exposure immunoglobulin. And lastly, my last slide, about few words about the antimicrobial stewardship, because antibiotics, unfortunately, here in Iraq are a lot of sometimes misused and can be prescribed and given to the patient without proper medical prescriptions. So we have to educate the nurse, educate the staff, educate the persons, educate the patients, avoiding prescribing or giving antibiotic without proper evidence of infections or clear evidence of infections, because otherwise it will result in widespread resistance to bacteria. مثل واحد عنده انفلونزا وياخذ اجى اخذ اموكسيل ومثبرين وضرب اوبركلافوران هو بس عنده sore throat ورينوريا وسنيزنج symptoms of viral infections. So by prescribing over prescribing these antibiotics يعني هذا المريض نفسه لو صار نيمونيا يجوز هاي الانتيبيوتكس كلها ما راح تشتغل عليه and will die from simple bacterial pneumonia. These are my references about my lecture, the standard textbook of your Davidson and the medical microbiology infection lecture notes. And thank you for your attendance and for your comments and questions. If you have any question, Tulab. About my lecture.
العفو دكتور.
Yes, Inas.
دكتور ليش دائما نستخدم يعني ليش دا ينطون الانتيبيوتكس هي اصلا مضره؟ ليش مثلا الدكتور يكتب له انتيبيوتك انه هو يعرف هالشيء مضر؟
Yes, antibiotics, if it is given in the pre-specified indication, it would be definitely it would be helpful, but otherwise it would be harmful. If it is given, why harmful? It's because it causes disruption of the normal human microbiota. It will result in creating the resistance strains inside the body. Okay, so definitely there are unfortunately some misuse of antibiotic prescription here, not in Iraq only, but worldwide. لذلك صارت عندنا هاي مثلا methicillin resistant Staphylococcus aureus, vancomycin resistant Staphylococcus aureus, أو extended spectrum beta-lactamase coliforms. يعني عندنا هواية resistant strains, Pseudomonas for example وهكذا. Why? Because of frequent prescriptions of antibiotic. يعني شو نسوي للأسف يعني مو دائما the prescription يكون proper. We have a lot of misuse of antibiotics, not only by even by the normal person. يعني هو antibiotic prescriptions يعني مثلا إذا تريدين أنت مثلا مورفين تروحين للصيدلية يعطيك إياه مو صح ولا لا؟ The pharmacist need a prescription. But إذا أقول له مثلا أنا بلعامي توجعني أريد أموكسيل, the pharmacist may give him antibiotic without prescription, right? Yeah, so there are multiple domains of this misuse of antibiotic.
تمام دكتور شكرا.
عفوا إيناس, thank you for a question. بعد شباب إذا عندكم سؤال, I will stop recording this lecture.